Hey, thank you very much. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Thursday, December the 10th. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. Tomorrow, Friday, there will be a written briefing at around 3 o'clock providing relevant details about COVID-19 in British Columbia, and we expect to be back here in Victoria on Monday to give an in-person briefing. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much and good afternoon. Today for our COVID-19 update, we have an additional 723 new cases diagnosed with COVID-19 in British Columbia, one of whom was epidemiologically linked, bringing our total number of people diagnosed with COVID-19 to 40,060. That includes 135 new people in the Vancouver Coastal Health Region, 456 in the Fraser Health Region, 10 people on Vancouver Island, 82 people in the Interior Health Region, and 40 people in the Northern Health Region. We now have 9,524 active cases across the province, of whom 346 are in hospital, 83 of whom are in critical care or ICU. Additionally, we have 11,947 people under active public health monitoring and 28,948 people who have recovered from COVID-19. Today is one of the most tragic days we have had yet, where we've had an additional 28 people die from COVID-19, bringing the total number of people who've died in British Columbia to 587. And all but 2 of these people are elders and seniors who were in long-term care homes in various places across BC. And these are family, these are friends, these are people who've had interesting and challenging lives and have spent this last 10 months dealing with the challenges that we are all facing with this pandemic. And our condolences go to the families, to all of those who cared for people and their communities who lost loved ones. We mourn with you again today. Thankfully, we have no new healthcare outbreaks to report today, and the outbreak at one of the acute care units at Burnaby Hospital is now over, and the outbreak at Rotary Manor and Northern Health is also now over. We do still have 57 active outbreaks in long-term care and assisted living and 8 in acute care units, involving 1,875 people, 1,194 residents with active cases still, and 671 staff. As we talked about yesterday, we now have at least one safe and effective vaccine that has been approved for use in Canada, and the start of immunization will be happening very soon. By this time next week, the first people in British Columbia will have been immunized. And as we shared yesterday, our COVID-19 immunization program will be starting, and this is an important, encouraging milestone for us in our response to our pandemic here in British Columbia. But I would like to remind people, we are not yet through this storm. We continue to have many new cases, and even in the last 24 hours, people have lost parents, grandparents, aunts, uncles, friends. We still have a long way to go before we can have the confidence that our communities are all safe and protected from this virus. We don't want to fall back, just as we're beginning this push forward into the final leg of what has been a grueling and long challenge. It is when we are tired, when we may stumble. And now, when we have a finish line that is in sight, we need to pace ourselves and need to continue working together, even though we are tired. No matter how much we want to resume those activities that we enjoy and that are important to us, right now we need to continue to work together, to follow the orders that we have in place, to reduce our contacts, to use our layers of protection all the time, to make sure that we are doing everything we can to keep those we love and those we don't know and our communities safe. The process to receive, distribute, and administer COVID-19 vaccines is complex, as we heard yesterday. And in these early stages, the details are changing quickly. Even today, we've heard 3 different updates on what is happening with the vaccine that we're to receive in a few short days. There is so much that is still in flux. That's why our province-wide immunization program framework has been built to allow us to be flexible, to be adaptable, and to be in step with every change as it happens. It's also why we all need to be patient. The sequence for the immunization that we have in BC has been carefully considered based on our pandemic goals and is aligned with what we have across this country to protect those who are most vulnerable to severe disease and to death, to save lives, and to minimize the disruption that we have within our communities across the province. I know that many of us are very anxious about when we will have access or when our family will have access to the vaccine. Until then, we need to keep these goals in mind and know that we are doing what we need to do to protect those who are most vulnerable. Your turn may be in the coming weeks. It may be a month from now. It may be in a few months. But for every person that gets that vaccine, all of us will be a little safer, and we need to remember that as well. There will be a time when we can take our masks off, when we can hug our loved ones, when we can travel to see friends and family, when we can be together again. We will get there, but we are not through this storm yet. That time is coming. Let's make the coming weeks, though, our winter break by breaking the chains of transmission in this province. So for now and over the holidays, and I'm reminded that Hanukkah, the Festival of Lights, starts today at sunset. Let's stay apart, not because we don't care for each other, but because we do. Because we want those we are closest to be here when we can be together again. Let's help each other by staying small, staying local, and pushing back COVID-19. And let's remember that this, more than ever, is our time to be kind to each other, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry, and I want to start by, on behalf of the Premier, on behalf of the government, on behalf of people, I think, to send our condolences to the families, the friends, the caregivers of the 28 people who passed away from COVID-19 in the last 24 hours, 12 in the Fraser Health Authority, 15 in the Vancouver Coastal Health Authority, 1 in the Vancouver Island Health Authority, and as Dr. Henry has said, the overwhelming majority of this group who passed away are in long-term care. We are thinking of you, and this is a profoundly difficult day for every single one of those families, but for the community and for all of us. And it underscores our point, I think, that even as we receive vaccine and see potentially a better future in 2021, that our work to save lives must and will continue for some time to go. We may not know anyone who passed away, or we may know and care for the people deeply, but their deaths should not just sadden us, should not just fill us with loss and grief and support for those who've lost loved ones, but galvanize us to do more for one another, to, when in doubt, rule it out, and to do everything we can to limit transmission of COVID-19 in this period where it transmits so easily and it puts so many people at risk. People in our healthcare system, as Dr. Henry has said, have done extraordinary work. The numbers today reflect 12,614 tests across the province, and the 9,547 active cases, the 11,947 contacts under public health surveillance, 346 people currently in hospital. All of these reflect an enormous effort by public health, and I'm very appreciative to all of our healthcare workers who we think of at 7 o'clock every day, but certainly we should think of 24 hours a day as they struggle mightily to help people in a difficult time. I want to report briefly on contact tracing recruitment and our initiative to recruit people in contact tracing in BC. To date, 1,165 individuals have now been hired. This is obviously more than the 500 initially announced in August and the 608 announced in September, and reflects the important and central role that each individual case has in our COVID-19 response. We've also approved increases to all the health authorities to bring the total number to be hired to 1,224 positions, a figure we're likely to get to in the next week. Might note that more than that, candidates, 123 candidates, are in the offer process, and 372 are in the interview stage. And just to give you a context regionally about where people have been hired, 545 people have been hired to date in Fraser Health, 259 in Vancouver Coastal Health, 71 in Island Health, 63 in Interior Health, 42 in Northern Health, and 185 at the Provincial Health Services Authority, which of course houses, amongst many other things, the BC CDC. I also want to bring you up to date on the surgical renewal commitment. Health authorities, of course, resumed non-urgent surgeries on May 18th. And since then, as of December 6, 2020, and completed a combined total of 187,143 surgeries, of which 146,318 were urgent and non-urgent scheduled surgeries, and 40,825 were unscheduled or emergency surgeries. Last week, health authorities originally reported from November 23rd to November 29th, 6,736 surgeries. Health authorities have now verified their data, and the total number of surgeries completed from November 23rd to 29th was 7,208 surgeries. That's 212 more surgeries than the same week last year. This week we were reporting a completion of 6,859 surgeries, and we expect that number to increase when the final tabulations are made. We understand that some fake text messages have been sent to the public, advising them that they have a positive lab result. This is happening worldwide and not unique to BC. If you are not tested, the message is obviously fake. If you have a positive test result, you will be contacted by public health. You can also confirm your positive test result and view it by signing up for the Health Gateway. This is a trusted and secure source for your lab result. Instructions to sign up for the Health Gateway on the BC Centre for Disease Control website. That's bccdc.ca. Just want to say finally that we know that it'll be well into 2021 before we're all able to get access to the vaccine. We need to keep doing what we've been doing, and indeed do it more, what we've been taught to do, what Dr. Henry has asked us to do, what the health measures require us to do. As we move towards the holidays and march towards the hope and promise of a new year, we must do it without building a COVID debt in December that comes due at great cost in January, for our vulnerable, for our hospitals, for those who care for us, for those that we know very well and love, and for those that we don't know at all. Aujourd'hui, nous annonçons 723 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 40 060 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 28 nouveaux décès liés au COVID-19 pour un total de 587 décès en Colombie-Britannique. Nous offrons bien entendu nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 346 personnes sont actuellement hospitalisées, dont 83 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to one question and one follow-up. I would also ask that you please take your phones off mute. You are not audible until your name is called. First question today is from Catherine Garrett, MyPG Now.
Hi, thank you so much for taking my question. Since the start of the pandemic, we've been hearing about the need for more local data from remote and Indigenous communities, particularly here in the north. Now in Fort St. James, there's roughly 40 positive cases of COVID-19 according to Northern Health. And my question is, why wasn't this made public by the ministry yesterday?
There are a number of things that we provide on a daily basis, and the dashboard on the BC CDC website is a place to go for that type of information. There is no outbreak declared in the community, and these are all cases that are being managed by Northern Health, and we know that it's been a stressful time. There's been transmission in many places, not only across the north, but that is clearly an area where we have seen increasing transmission in many communities across the north. So that is, we do declare outbreaks and we report on those, but the endemic or the transmission that's happening in communities around the province is not always related to an outbreak. Having said that, though, we, as more cases accrue, we're able to give more information at a more local level. And as of this week, as of today, we will be posting on the BC CDC dashboard the local health area data, because we're now at a point where you can't re-identify somebody by the geographic area that they live in because of the number of cases we've had. So you will recall that early on we reported only by health authority, and then we reported by health service delivery area, which is smaller, and by local health area. And the local health area reports came out monthly. We're now at a point where that information can be shared on a weekly basis. So you'll see that today posted on the BC CDC website.
Catherine, do you have a follow-up?
Yes. On that note, if a similar situation were to play out in a community of a similar size, roughly about 1,500 people, how would that change the notification process? Because I understand the residents of Fort St. James weren't made aware of the amount of cases in their community until Emergency Health Services made it public yesterday.
Yeah, well, this is what we do with every community, and it is a matter of understanding who's been at risk, who is diagnosed with COVID, and that's the public health work, the public health follow-up. And so it is released in a way that doesn't identify people, so that we encourage and people have the confidence that they're not going to be exposed to others in their community. And it is unfortunate that in many communities now there still remains stigma associated with this disease, and we have heard from many people that it is a challenging time for them, and that they don't always get support from their community when they've been identified as having COVID-19. And I think this is a message for all of us. This virus doesn't understand who we are or where we live or what community we belong to. And it is transmitting in all communities around BC. And we all need to support those to get tested so that we know if we have it or not, and to take the measures that we need to take to support each other to prevent transmission. And the orders and the instructions that we have in place in BC are to do that. It is a reminder to all of us, no matter how small your community or how large your community, this virus is transmitted from people, and it's transmitted to the people we are closest to. And we need to take those measures now to reduce our contacts with people so that we reduce the chance that we're going to be exposed and we're going to pass it on to others.
Next question's from Binder Sajan, CTV.
Hi, Dr. Henry. Hearing those 28 people who passed away in the last 24 hours is quite difficult, and just wondering what your message is to perhaps residents in long-term care or their families who may be worried about the next couple of weeks before a vaccine comes in, and maybe wondering if you're considering any further measures, people who are worried that they might not be able to see their loved ones again.
I know. I think we take this very much to heart. it is a tragedy every single one of our elders and seniors who pass away. And the challenge that we are in right now is this is reflecting the outbreaks that have been happening in long-term care homes, particularly in the Lower Mainland, but also in other places in the province now too. So people who died this week are related to outbreaks that were happening for the last several weeks, unfortunately. So there are people right now in care homes who have COVID-19, and we are sending them all of our positive energy and thoughts that they will pull through this. But the reality is we know that some people will not, and that is something we're going to have to live with. But it reminds us now how important it is to do everything we can to protect our seniors and elders in our community and in care homes. Of the heartening news in the last 2 to 3 days, we've had one new care home outbreak, and a number of them are very close to or have been declared over, which means we've gotten through that in many, many cases. But today I reported there are over 1,000 residents right now who are in that critical phase where they have not yet met the recovery period for COVID, so they are still at risk. And that is what we're facing right now. Why it is so important for all of us to take those measures that we can to protect people, to stay away if we're feeling ill ourselves, to connect with people remotely during this period of time. Starting next week, we are going to have vaccine, and it is going to make a difference, particularly in care homes, where we can protect healthcare workers so that we can build that wall around those who are most at risk in our long-term care and assisted living homes. And so that is what we are going to start next week, but it's going to take some time, and all of us need to pay attention to that now and do what we can to keep this virus at bay.
Pinder, do you have a follow-up?
Yes, thank you. And just speaking of the vaccine, will British Columbians who are immunized get some sort of paper or digital record that they could show as proof of vaccination if, say, a business, an airline or something requires that for access? And if so, when could that happen and what could it look like?
Yeah, the details that are all being worked on. The short answer is absolutely yes. We all need to have an immunization record. We should have a record of all of our immunizations, and we are looking at that you will need one for this, and likely a hard copy, but we are also looking at can we create digital tools as well, for a couple of reasons. One, so that you know that you've been immunized and with what product you've received. And as we know, there's as many as 7 different products that will be in use at some point here in Canada. So we need to make sure that you get your second dose with the right vaccine. So that's part of it. The second part of it is we need to record who gets what and down to the lot number, so that if there's a safety signal or some reason that we need to know who had which vaccine, we're able to follow up with people rapidly. So we do have what we call an immunization registry in the province. What we're working on, and still not entirely sure what it's going to look like in all cases, is how do we get the information quickly into that registry and get information out of that registry so you can have access to your immunization record electronically, as well as the hard copy form that you'll get when you're immunized.
Next question is from Richard Zisman, Global News.
Sure, you're hearing from a lot of people grappling with what they're supposed to do at Christmas time around, seeing their family. And there's a few scenarios I'd like to ask you about. The first specific scenario is we're hearing from a lot of people who are in one household and they are hoping to isolate for 10 days with another household of 4 who will also isolate, whether those 2 households can join for the holiday. And the other common situation we're hearing about is grandparents who have been caring for their grandchild through the pandemic, whether they can spend Christmas with that grandchild and what in essence would be the extended family of, a household of 3, 4, or 5 in that situation. If you could speak to both those scenarios for me, please.
I've been inundated with hundreds of what about my specific situation? And what I tell people is, look at the intent of this. The intent of this is to reduce those transmissions that we can have when we get together, when we have social interactions. So the bottom line is we want to, as much as possible, stick with our household. If your household regularly includes your grandparents as part of caring for children, then you can make that decision about that risk to you, to your grandparents in particular. But what we don't want is large numbers of people coming together. So if it's you and your sisters and your brothers and their family and their kids, that should not be happening this year. That is what is risky. That's when we bring our risk with us and we share it in those close contact situations within our homes, when we're eating, when we're being with people that we love. So we need to show our love for each other by staying small and staying with our close family unit only.
I think these are good questions, Richard, because, and certainly there are a number of the hundreds of questions that we get every day about these scenarios. But I think what I want to say, in addition to what Dr. Henry has said, is that when you're in doubt, rule it out right now. And it reflects on the questions that we've heard so far and the results today, which show more than 700 new cases, show cases in all parts of the province. A significant number of people passed away in the Vancouver Coastal Health and Fraser Health Authority. That this is the time. It's going to be a different Christmas this year. And where there's an option for the protection of the ones you love and the protection of everybody else, this is not the time to gather. When in doubt, rule it out. And I think it's important consideration right now, because this is what we can all do. Every effort, I mean extraordinary efforts, have been made, both financial, but the efforts of healthcare workers and others in our society to help keep us safe. And BC has a lot to be proud of during this pandemic, but this is a crucial moment. And I guess my message to everyone is there are lots of scenarios, but if there's any doubt, err on the side of keeping the ones that you love safe.
Do you have a follow-up, Richard?
Just two more scenarios for you. And I know that these are individualistic and you get a lot of emails about this. One that we hear a lot about is a single person, many that have reached out to me, and I'm sure to you as well, or a widower, and they would like to go to visit their son or daughter and their family. Is that possible, and it doesn't make a difference if they live in the same city or not? And then one we get a lot from kids, and I know it's a very tragic day, and kids are trying to find light in this, but is around Santa Claus. And I know you've spoken about this before. What sort of rules are there around Santa Claus visiting? And I'm sure you've heard from a lot of kids around that as well.
Yeah, and I think you're absolutely right, Richard. It is important that we find the joy every day, even on tragic days like today. You know, we have the spark of hope of vaccine that's going to protect our grandparents and our elders. So those are coming. And yes, it's very challenging to be on your own during this pandemic because it's very isolating, and we know that. So yes, people need to find what they need to do for themselves. And that means if it's somebody that you are close with, but it's not each of your children, not going to multiple different houses. Pick one. Pick ways of being together that protect, particularly if it's an older person. You know, we need to take those measures to protect our seniors right now so that they will be here when we have Christmas in July. In terms of Santa Claus, though, I have it on very good authority that, you know, he's first in line for vaccine and that he's immune to this virus, and we expect that will be the case by Christmas time, and that he is able to do what he usually does. But I will say a couple of things. He's going to be very, very careful, and he's going to be wearing masks when he's in houses, and he's going to be cleaning his hands a lot, and the reindeer are going to be very careful as well. So no leaving out the cookies and milk this year, and let's just be happy that he can make it around the world.
Next question is from Tom Zatarik, Surrey Now Leader.
Good afternoon, Dr. Henry and Minister Dix. Thanks for taking my question. Some clergy members are expressing concern at the messaging they're hearing at these briefings. Reverend Aaron Dick of the Gateway Baptist Church in Surrey recently wrote a letter to Minister Dix, and he writes, I quote, I feel compelled as a faith leader to request that people of faith be given the respect that is so overtly presented to every other particular group in this great province. The constant condescension by Dr. Henry, purporting to tell us what faith is, and the endless patronization, as if the government understands anything at all about what constitutes faith itself, let alone its practice, has long past worn thin. Dr. Henry, what's your response to this?
You know, I think sometimes people take what I say and twist it to make their own ideas about it. I have repeatedly said that I have taken advice and had the privilege of speaking to many faith leaders in the last few months, and I appreciate their advice immensely. I have learned a tremendous amount from them, and I have said on occasions what has been told to me about beliefs and about faith. And I do absolutely believe that we need our faith leaders in crises like these more than ever before. And I really want to give my thanks and praise to the many, many leaders out there who have sent me their advice, their thinking, their thoughts, and the fact that they do understand the need for us to take measures to protect those that we care most about in our community right now. And I think, you know, we need to realize that there's fundamental differences between some of the things that I'm sorry, I've just lost my train of thought around that issue. But, you know, I don't purport to know everybody's ideas about faith, but I do know that there are great leaders in our community that are stepping up every day and supporting the people that they care about in their congregations and doing it in a safe way. And I just want to salute them. They have my gratitude and my admiration.
Tom, I guess I'd say to Reverend Dick in this case, because he sent a letter to me that we have from the beginning, I think, listened to and reached out to faith leaders in BC, to hundreds of them. And I have a little bit of understanding of my idea of faith. I don't think it necessarily will be everyone's. But I can tell Reverend Dick that in our church that we've lost a lot of loved ones this year, including our minister, and that the loss of being able to come together on Sunday has been profound for members of that congregation, just as they have been for congregations around BC. And I am overwhelmingly inspired by the work done by faith communities of all faiths, of all denominations, to support people in their community in a difficult time. And so all I can say is it's not condescension, it's gratitude that we feel for the support we get in our community, wherever we find it. And for many people, that's in communities of faith. So we're with you, and we're asking you to join us in helping in this period to help heal ourselves physically and protect ourselves and our good health, and also stay healed and stay better as a community. So I think that's all I can say to this, that I think Dr. Henry has been unbelievably respectful. I so admire her approach when she talks about kindness, which is at the core, I think, of faith, of many faith views as well. She lives that every day, and I'm so proud to stand with her, and I just so disagree with the criticism that came in the letter.
Tom, do you have a follow-up?
Well, Minister Dix actually anticipated my follow-up question, so I thank you both for your responses.
Thank you. Next question is from Marcella Bernardo, News 1130.
Thanks, Lindsay.
Dr. Henry, I wanted to ask you more about the rollout of the vaccine and safety issues that arose yesterday. You mentioned that you're reluctant to say where the vaccines are going to be administered because of safety reasons. Could you elaborate on whether or not that's because you're worried about people trying to steal it or people trying to sabotage it?
Well, it's more the latter, and it's really around information that we've received internationally and from Canadian agencies that there has been a concerted effort to try and interrupt the cold chain, for example, and to sabotage immunization programs. So that's part of it, and we all need to make sure that we are taking appropriate precautions to make sure that it is safe and that we can make sure that it's not tampered with during that whole process. So that's one of the reasons. The other, of course, is that it is in ultra low temperature freezers, so they are in tertiary care hospitals for the most part, or healthcare facilities that are able to accommodate that type of a freezer. They're not small, and we want to make sure that we have appropriate precautions in place so that people are able to come and go freely, and that we're taking all the measures to handle the vaccine safely.
Do you have a follow-up, Marcella?
Yes, just regarding the number of deaths that we had reported today at 28. I know Binder talked about this already, but what is your message to families who are now desperately hoping that this vaccine can be given to elders in these care homes so that there is hope that they won't expire? It's just, time is so precious right now for many people that are now battling this disease.
It is, absolutely. And, the people who are infected right now, this vaccine is not going to help them. But, we have 57 healthcare facilities, long-term care homes where we have outbreaks, and we have another 600 and some where we don't. So protecting them is our important role. Doing everything we can. We've been working on, particularly in the Lower Mainland, where the most of them are, making sure we're stepping up everything we can do to keep the virus out, and the vaccine will help us with that immensely, particularly protecting healthcare workers and those who work in those facilities, and then as soon as we can, providing vaccine to residents themselves.
Next question is from Eva Eugen, CBC.
Hi there. Regarding the current situation in Fort St. James, can you tell us how many people are having to leave the community for higher levels of care? And could we get the answer in French as well?
Yeah. The details around higher level of care, I believe there are 20 people in hospital and 3 who've had to leave the community for various reasons, not all of them related to COVID. And there are 39 active cases, 20 people hospitalized with confirmed COVID. And yes, there were a small number that have had to be released for moved to other places for a higher level of care. I will say as well that early on in this, we recognize that people who are at risk of having more severe illness or needing hospitalization, we have a program in place to move them closer to some of the higher level of care facilities. So there are some people who've been moved from the community and supported by BC Housing in different areas closer to healthcare facilities. And we recognize that that also is very much a challenge for families if their loved one is moved out of the community, just to be on the safe side. And I know there have been 3 people transferred down to here to Vancouver Island, and at least 1 person to Vancouver for needed procedures and the care that they needed in those facilities. On process.
I think it reflects 2 things to the number of hospitalizations. One, it reflects the relative vulnerability of some of the cases, and you see that. And secondly, it reflects what we do, particularly in more remote communities, is bring people closer by either into hospital In the majority of cases, that would be Prince George Regional Hospital or wherever they can get the best level of care. And so if you look at the overall hospitalization against the number of active cases, you would say that 20 out of 39 is significant. That's part of the reason why. And as Dr. Henry has said, consistent with our rural, remote, and Indigenous plan, we also are cohorting people, so allowing people to move closer to a higher level of care if that is recommended, and so that they can stay there and they can be closer to that higher level of care in case their conditions deteriorate. And as Dr. Henry has said, we have 3 people who have been transported from the north to Vancouver Island and 1 to Metro Vancouver. Je veux dire en français que la situation Fort St. James est bien entendu sérieuse. Il y a actuellement 39 personnes qui sont des cas actifs dans la région de Fort St. James et dans les communautés autour de Fort St. James. Et il y a 20 personnes parmi ces 39 cas actifs qui sont actuellement hospitalisés, la grande majorité à Prince George. Donc ça vous démontre la situation là-bas. Force est de reconnaître que c'est en pourcentage, c'est beaucoup qui sont hospitalisés dans ce cas, mais c'est normal dans le Nord. Surtout, on veut envoyer des gens et accueillir des gens tout près, souvent des niveaux de soins élevés, surtout à Prince George, mais dans 3 cas, 2 sur l'île de Vancouver, 1 dans la région de Vancouver, pour assurer qu'ils reçoivent les meilleurs soins possibles pour eux et pour rassurer la communauté autour de ces personnes. Donc c'est une situation difficile, mais je voudrais saluer tous les travailleurs de santé dans la région, les infirmières, les médecins, etc., qui font un grand travail actuellement, et il faut les soutenir, et je veux les reconnaître aujourd'hui.
Eva, do you have a follow-up?
Yes. Public washrooms facilities have been considered a necessity during this pandemic, but we're still hearing that in a lot of places, like some gas stations and coffee shops, that those washrooms are not accessible and they've been closed, and that's become an issue for people living with chronic illnesses. Dr. Henry, what's your advice to establishments who have shut their washrooms about opening them on compassionate grounds?
This is not something that I've been aware of recently. I know early on there was concerns, particularly for people who were homeless or street involved, and I know there's been provisions made in many communities to provide places where people can use the washroom, where they can clean up and have a shower. It is an ongoing issue, we know, in many communities, particularly because of the challenges with our shelters and places that people may have gone in the past where they need to have fewer numbers because of the risk of spread of the virus. So, you know, we do encourage people to make it available to those in need in a safe way, and much of that is done through community groups in different communities around the province.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Keith Baldry, Global News.
Henry, just wondering, the NHL season is expected to begin January 13th. There have to be training camps for clubs. There's a report out today the NHL is buying a private batch of the vaccines. Under the current health order, would the Vancouver Canucks be allowed to conduct a training camp?
I had not heard about vaccine. I'm not sure where they're buying it, but the Canucks, as the NHL, we've been working with them all along, and I understand they have a plan for return to practice and potentially return to games. I know they are looking at a Canadian league versus going back and forth across the border. So currently, the way things stand, they would not be able to go back and forth across the border to play games, and we would not support that. But I've not yet seen the details of it, but we are supportive of a well developed plan for return to practice and for games that involve travel within Canada. We'll be in a different situation sometime in the new year, and I know it's still a little bit in flux when the season may start. And as a matter of fact, I'm pretty sure we have a call about this I saw in my calendar in the next couple of days. We are connecting with the Public Health Agency of Canada, Dr. Howard, with our colleagues across the country in Alberta and Ontario, Manitoba with Winnipeg, and Quebec around, so that we all have a common message and a common understanding of how things will be done with the NHL.
Keith, do you have a oh, sorry. Go ahead. Do you have a follow-up, Keith?
Yes, just back to Martella's question. In terms of security of the vaccine and prevent sabotage, I assume the police and perhaps the armed forces are working with public health to ensure that?
Absolutely. So RCMP have been involved, and at the national level, as you know, Department of National Defence has been involved supporting the whole operation across the country. So we do take advice and support from them here in BC. They've been part of our Emergency Operations Centre and providing support and advice too. So it's a comfort to know that we're all talking to each other. It's going to be a very complex operation over the next few months. We're just really excited to get it going and for it to get into the arms of people and start saving lives here in BC.
That's all the time we have for today. Thank you.
Thank you.